So I'm here with Dr. Nair Khankhanian. She's still at Kaiser.
Yeah, yeah, right. I'm
So
per
she's
diem.
Chief of
I'm retired.
Pathology at Kaiser Permanente.
Yeah, surgical pathology.
Like a surgical pathology at Kaiser Permanente in Los Angeles. How long were you there for, or have you been there?
Since 91. So next year would be 30 years. Yeah.
That's amazing.
Yeah.
I just wanted to have her on and to talk about this whole thing with COVID-19. She happens to be what are you to me? What are we together here?
I'm your father's cousin, so I'm a second line. You're a second line cousin.
My second cousin, yeah. We have a big family tree. Yeah, it's pretty crazy. What are your thoughts about how Trump is kind of handling, not only the pandemic, but the media perception that, everything, I feel like a lot of times the media perception is basically they're just going after him instead of
right.
trying to back up.
Yeah. Meaning uprooting him.
Yeah.
They're trying to uproot him, but obviously they won't be successful.
Yeah.
Because people see through it. Right now, I read a lot of articles, and even, Senator Tom Cotton from Oklahoma, who's sending a bill to the Congress that we need to sue stupid China, and then they're the one who really purposely did that, and they knew that. And how come their own next door cities like Shanghai and Beijing, yeah, they're not involved.
Yeah, there was don't quote me, but I want to say it was less than 100 for Shanghai and someone 75 for Beijing.
Right, it's just right next door, and then 10 million got infected in Wuhan. How could it be?
I know, and it really makes you wonder, because it's just the chances of that happening are so low that it makes you wonder. I don't want to say bioweapon, but I want to say if it could be possibly an accident out of a lab. And right now it's hard because we don't have sources in China. They cut off.
If an accident in the lab, they would be honest. They say, oh, we have this, close your borders. If it's accident, how come you don't tell us? You had it since October, God knows, since November, and then you tell the United States in late December or January?
Yeah, it just something doesn't really add up to me. And I think the fact that at one point they blamed the U.S. Army for it. It's kind of like when you're in a fight and you're losing the argument, you kind of flip the switch and you're like, well, you did so-and-so,
Right. Well, especially when they know that Trump is known not to be warmonger. He's not like Bush's. He doesn't like military involved in that, even though it's strengthening the military, but doesn't like to have military conflict. So they said, okay, this is the best way to tell them that they don't want to militarily fight. They're doing biologically.
Do you understand any part of the pathogenetics as far as how it goes from supposedly that to
any organisms that comes from non-human, let's say from animals and birds and fish and non-human to human, they mutate in order to survive on our cells. This particular one, as you mentioned, that it's got those receptors that binds with the receptors of the cells in the alveolar lining in the lungs. And then, it gets incorporated inside the RNA of the cells, and it starts
replicating.
Right in the cells, and then boom, they go bananas. Yeah.
But does it seem odd to you that it was able to go from a bat to human in such a quick span of time? Doesn't usually when these things happen, don't they have to adapt to the human body before
to mutate?
Yeah, if it goes from a bat to a human, it's a new environment, so it's not going to immediately survive being inside of a human being's body. There's changes that have to take place.
Yeah, well, then again, how did we know that when they said it happened, it was the time that it happened? How come we don't believe them that this happened quite some time ago?
I do not know. Yeah,
Uh-huh.
it really, there's so many things that we don't know right now,
We
and
don't
we're
know,
kind of just
right,
trying to play damage control.
right.
I think that's what's most important. I think you can always get back to, who started what and do more investigation. But right now it's all about, closing the borders and making sure the American public are safe.
Mhm.
Um, and unfortunately, I think the number of deaths they're still going to go up for the next several weeks.
Well, maybe this week and next week would be the peak. But I've been emailing and telling people the way they were showing the bell curve. We were already at the midway last month, so it took a month. If Italy is a model, not China, if the Italy is a month, then we are reaching the very top.
Yeah.
So we are peaking this week and next week, and it starts rolling down.
What do you think about the shortages in N95 masks? Do you think it's
They're holding China. Yeah, they are supposedly coming from China, A to Z coming from China. So it's either they holding it or we didn't want it imported. Otherwise, it's just like 5 cents, not 50 cents, 75 cents per mask. It's not that expensive
to
an
make
item.
them, right?
But they're making them, they made them right now. Today, he was saying on my way coming home, I was listening to him.
Yeah.
He was giving these astronomical numbers that are on the plane that they're coming.
Yeah. Do you think that when it comes to these types of pandemics, do you think they will come in waves? Like this one will go away and then
Right.
another
Exactly.
20, 30
Because
years.
this is another coronavirus like SARS, like MERS, that they're in the same family. So then, yeah, they mute. Once everybody gets immune to this, either by vaccine or by catching it, then another family of this comes up, mutate, and then, yeah, there would be another pandemic.
Yeah.
How many did we have in your lifetime? We had Ebola, right? H1N1, bird, Zika.
Yeah.
They,
MERS, SARS, all that.
right. They know it, and I don't know why they don't get prepared. Not only us, nobody gets prepared. You can't. How could you get prepared? Why would you have hundreds, thousands of ventilators when you don't need it and hoard them someplace until 10 years or 20 years from now that you may need it?
I think we've come to a crossroads where unfortunately, something like this had to happen where we were not prepared for a pandemic such as COVID-19. We're at the point where from now going forward, it's all about preventative measures. And I don't think life is going to be the same for not even American citizens, but world citizens due to what's going on right now. And I try
right now it's pretty.
Yeah, I try not to blow it out of proportion, but let's face the facts. Like it's something like this is bound to happen again, and as technology gets more and more advanced, these can become more and more dangerous. I don't want to go into the whole 5G conspiracy because there's no data to back it up, but it does make you wonder.
The 5G.
That 5G is actually not beneficial to the body, and now that in the world we're developing more 5G towers, I don't know if there's a linkage, and I don't want to speculate. But it definitely begs, our attention. It definitely has me alarmed.
Well, the world is so competitive, especially American, that there would be other companies that go after 5G, and then in order to really be a rival, they will do study, and they will find out whether that's true or not.
Yeah.
Yeah, they will. They can't hide. They can't. No company can hide. Well, for a while they will.
Yeah. Eventually something comes up.
Like this drug that everybody is saying that is very effective, has been effective, hydroxychloroquine. Yeah. Right now, is my theory that they don't allow it to really go be freely available to everybody because it's cheap, it's generic. They should be able to provide it for everybody for like $1 per dose. They don't, because there are many other companies. They're trying to come up with the new drugs. They don't want this generic. They don't want this cheap one. They want to have a new one to so that, yeah. Especially that Teva is an Israeli company.
Oh, they're the ones that are coming out with the drug.
Who's making the generic of it? Yeah. And they already given 6 million doses. They donated it, 6 million doses to New York City.
That's incredible.
Yeah, they've done that, but it's the headquarters in Israel, but they have companies in 150 countries, and they're making generic drugs of all kinds.
Did you hear Trump said he's going to not ban, but stop funding the World Health Organization? Or he said,
yeah,
consider it.
I love it.
Yeah.
I love it.
Yeah.
Yeah, it's the same thing he did with NATO, with the United Nations. Yeah, he's after everybody who's not acting right.
Yeah, I think, it's interesting to me because my parents are, honestly, obviously, everyone's affected, but it makes you, like, I feel a little bit of anxiety because I worry that my parents, anytime they go out of the house, this and that's as scary as that sounds.
Yeah,
this is an infectious virus. People say, well, it's just the common flu. No, it's not.
No, he's
one time.
No, I spoke to you. I spoke to your dad. I've been in touch with him very closely. No, he's worried about her, and he said, I'm the only one going shopping, and then when I come home, I take my shoes off, I take my clothes, everything I bring in, we disinfect it, and then he's pretty careful. Yeah,
that's what I do too. Like right outside on the porch, I'm just taking the clothes off and throwing it right in the washer.
Maybe it's overreaction, but it's better to be overreacting than not reacting. I guess
we're Lysol. I mean, I'm so glad 2 months ago I made a big order of Lysol wipes because I just had this weird feeling.
Yeah, I don't have. I'm running.
We're going through. Don't stop by my house. Come by anytime. I'm just kidding.
No, I'm running out of my wipes. So what I'm doing is just putting some Clorox on rags and paper towels and using it. So it's the same thing.
Right. Yeah. Well, I know a lot of people that are using. They're mixing alcohol with aloe vera, and they're making it. I think it's very creative. What do you think about the cloth masks that they're recommending now? Do you think it's going to play a role, or do you think it's just a cover up for?
I really feel like whoever has the disease must wear very heavy duty mask. Who coughs and sneezes, but this is not aerosolized. It's not really freely wandering in the air for you to.
That's what upsets me. Like one day, Dr. Anthony Fauci is, the head of the National Institute.
Right, I know that little boy.
It's like, oh no, don't worry about it. And then last week at some point, he says something along the lines of, and live in the air for 3 hours. And it's like, well, are you talking about like closed confined spaces,
right? Yeah,
or like out in the open? Because there's a big difference. I know a lot of people go running outside without a mask on.
Yeah, it can't be that virulent. It's not, because people are still going out, doing shopping. People are still contacting with some people who are either symptomatic or asymptomatic. But how many percent of those die, get the disease and die? How many did they have? Did they have any data on that? In our family, we have your uncle, right? We have Baman. We have my brother. We have Shirin's brother-in-law, and I have one of my friends who got it. All right, and they all self-resolved.
Quarantine, yeah.
Not only quarantine, but it's self-resolved. They didn't have to go to the hospital.
Oh, right.
They didn't have to have an extra treatment, so just Tylenol, just like a flu.
Well, what's interesting today, Dr. Fauci said that up to 50% of patients that have COVID-19 may not even know they have it.
Right.
Meaning all these people, they're saying 80% mild symptoms, 14% in the ICU, 6% critical. That may just be making up just 50% of the population.
Right. Well,
There could
that's
be
it.
another 50% that actually have the infection and don't even know it.
Right.
And so
Right.
that's the most alarming part is that,
So, well, this is what they have. This Abbott Laboratory has that 5 minutes test. It came out a few days ago. So I think they should.
can you explain to me what an exosome is?
Yeah, it's a particles that is not quite a virus. Is not just like virin. It's not obviously not bacteria. It's in the family of viruses, but it's not doesn't have the same properties.
I listened to a
Yeah.
webinar last night talking about how the COVID-19 exam is some sort of a PCR exam,
Right.
and that
Right.
people who are releasing an X amount of exosomes, this could be triggering a false positive.
Mm-hmm. Right. Yeah, but it's so tiny that you can't culture it. The viruses as in general. So you have to use that
Exam.
particular test of a PCR. That means enhancing it, and then you can study it or make a vaccine against it.
What I worry is that someone who has chronic, I don't know, COPD, diabetes,
Right.
or like some sort
Right.
of inflammatory issue where their
Right.
body is expelling
Right.
these exosomes, and you magnify to a certain extent. Well, sorry, you tested positive, but I don't feel that bad. Well, you
Uh-huh.
still go
It
into
could
that.
be. It could. Yeah. Of course, it
We're
could
kind
be
of not,
that.
not that we're trying to deliberately pad the numbers. I'm not saying that. I actually think there's more people infected than there really are, but um, you would think by now. I think the PCR exam, the founder made it in 1984. Like by now, we should have something that's more specific, and that's what worries me the most.
Right. Right. Well, this will come eventually. They will know. It's just like TB, right? Tuberculosis. We didn't know that there was other cousins of it, like MTB. MTB was, some people had the symptoms of tuberculosis, but they didn't have that cavitary lesion in the lung. They didn't have all these granulomas and abscesses, and it just didn't quite had the same as TB. And then when they did all of these studies, and then they did the PCR, they learned that it's a different sect. There's a different family of it.
Yeah.
Same thing with this virus.
It's just going to take some time.
They're going to find different types of it.
Yeah. What are you doing at the house to make sure that you're staying clean and taking care of yourself? You gotta be careful.
I don't overdo it. I never lived in a sterile home or a sterile life. You're not supposed to sterilize your life. Why doctors are not dropping right and left? Because they're immune to so many, you're exposed to so many patients with so many disorders or bacteria and viruses that you get immunity with the small viral load. It's just like a vaccine. You're exposed a little bit.
Yeah.
So I don't think that we should really try to sterilize too much.
Yeah.
Yeah, the hand washing about 20 seconds, 50 times a day means you got to be by the sink all day long.
Happy birthday song. Just sing that. That's what everyone says. Just sing that happy birthday song. By the time you're done, it's been 20 seconds.
Yeah, but how many times you can do that?
Yeah.
Yeah, so be cautious, clean up, yes. And I have, my brother's coming and going. Tomorrow he's coming. Neda is coming. My aunt, Mora's wife, Oma.
Mm-hmm.
Oma's coming.
Mm-hmm.
So we're gonna sit apart, and then Dennis Prager is going to broadcast the Seder.
Yeah.
On YouTube. We're gonna connect to him and
that's amazing.
follow it.
And then you're finding ways to, I mean, I don't know about you, but we're, my wife and I are finding ways to Zoom everyone, like our cousins and my sister who lives in LA. We find ways to connect. And right now, surprisingly enough, I'm closer to my cousins than I have been for years. Like we don't get to see each other as often, and now we have this connection.
Oh, with the ones in New York, you connect.
Yeah, like we talk every day on WhatsApp. Yeah. Like I send pictures, we Zoom calls. So
so you guys are more advanced. I call Jamshid and Saeed, and we just phone on the phone, Dariush, and my age.
Yeah.
Cousins, yeah. Well, your father, I do every day talk like to 10 or 15 of them,
Yeah.
and my friends, and then do a lot of computer work, and I do a lot of paperwork, and do try to organize if you can. It's hard to focus. It's
Yeah,
hard to focus.
it really is.
And I am the type of person, because like a lot of multitasking people, you have to have a lot of things to do. When you let go, you become lazy.
Yeah.
You don't want to
I
think.
think I find it important to block up your day in small segments. Do you understand? Like,
Yes,
from 6 to 7 a.m. I'm working out and I'm doing meditation. Then 7 to 9 I'm doing things for my practice.
you
And
have
then
a
from
schedule.
yeah, and that helps me keep my sanity. And my wife, God bless her, like, she's always taking care of the baby, and I
Baby,
help out as much as I can. But it's like this constant struggle of, okay, just don't fall out of
what
routine,
else?
stay on
What else?
schedule, so that your Saturday actually can feel like a Saturday. Make some, like, last Saturday we went out and did a picnic in our front yard. It helps
Yeah,
to have those things where you look forward to it.
exactly. No, I think we should have a schedule. So do you Zoom with the patients? If somebody shows you
I've been
your foot?
doing Zoom. Yeah, I've been doing Zoom and a company called Beam Telemedicine. And then
Uh-huh.
there's a answering service called June that basically answers my calls 24/7. So they set up my telemedicine calls, and it's been good. Like, it's amazing how technology has
This,
changed the
that,
way you
I,
practice.
yeah, I see that to become, as a matter of fact, I was going to tell you that Kaiser 4 or 5 years ago started piloting telemedicine at Walmart. What is the other one?
Wow.
In the malls, Walmart, and then there's another one, Target. Walmart and Target, and at the malls had a little kiosk with the one nurse in each.
Wow.
And then, yeah, if you go shopping in the mall and then you feel like your throat hurting, you go to this kiosk and they connect with the patient like we are doing. And then if they could figure out and give them medication, they do. If not, then it says, okay, you got to come and see us.
That's smart. It's
But
preventative as well.
right, this telemedicine, they did it for 5 years,
They
and
knew
then
it was
now
coming.
now
Yeah,
now
yeah.
it's
This
catching
is
up.
another frontier that we just got in. Like, this is it, where
Uh-huh, uh-huh.
everyone's going to have access to telemedicine, and that makes me really happy, because a lot of times, and especially for people who live in rural areas,
Yeah,
Lancaster, Palmdale,
right,
or
right.
like live in like upstate New York, outside of Albany, 30, 40 miles, and there's
Right,
no
in this
doctor near
in
you.
this heavy traffic, who wants to come, all the way to Beverly Hills to see
Yeah,
you?
right. Yeah, I agree.
And if it's something manageable with a nurse in that, or a PA, they put a PA or a nurse. If it's manageable, they do that. If not, then they said, okay, come tomorrow, get an appointment, we'll see you.
Yeah.
Or they have portable X-rays. If they have short
Wow,
breath, yeah, they X-ray it. And yeah, it's just like a mini clinic.
that's great.
So right, they started doing that. So now that there's no mall anymore, maybe they move that to more of a, I don't know, corner of a
Yeah,
street.
yeah. Well,
Corner.
great talking to you. Thank you so much for your time. I appreciate it.
Well,
I
wonderful.
love you.
I love you more. Do that more often. Maybe we
People
talk.
don't know, like, Dr. Khankhanian lives like 5 streets away, and so maybe I can walk outside and hang out outside the door.
Yeah, please, please, please. Now we need to see you.
Thank
Definitely. I
you.
need to see that little girl.
I will. I will. Thanks for your
Okay,
time. I appreciate
great.
it.
Yeah, Hak Sameach for tomorrow. Have a
Thank you.
wonderful time. You're gonna Zoom with your parents and
With
sister.
everyone. Exactly.
Right. Okay,
Thank you
fantastic.
so
And
much.
we're gonna watch it on
On
Dennis
online.
Prager.
Yeah.
I love you.
Love you. Bye.